Up to 60% of ER visits are a total waste. For something like a cough, you may need an ER, you may not. So in this video, as a seasoned nurse of 15 years, I'm going to tell you what to do when your kid has a cough and whether it's a true emergency or not. Side note, the most dangerous situation is a cough paired with significant respiratory distress. So if your kid is struggling for every breath, unable to speak or cry or making grunting sounds, or has stopped breathing, stop this video, call 911. I'll wait. Just pause. If that 911 look doesn't fit your kid, then the following reasons are when we should go to the ER. First, look at your kid's chest and neck. If the skin is pulling in deeply between the ribs or the base of the throat with every breath, and your child's working pretty hard to breathe, that belongs in the ER. Another concern is if their lips or face appear bluish or gray, but only when they're coughing. This also belongs in the ER. These symptoms often point to severe oxygen deprivation or an infection. So if your child is less than 3 months old, so a little baby with a cough and a 100.4 rectal fever, this belongs in the ER. Infants' immune systems aren't fully developed at this age, so being seen in the ER is important to rule out any major concerns. If your child is older than 3 months and has a temperature of 105 or greater by any route, by mouth, under the armpit, forehead, that needs to be seen in the ER. If your child is older than a year old and isn't urinating as much because they aren't able to drink as much, I mean, we're talking if they haven't peed for 12 hours or they have a very dry mouth, that belongs in the ER. Now let's move on. If your child's symptoms don't really require an ER visit, we can save time and money. You can just avoid the ER altogether. These next symptoms are for if you can be seen in the urgent care or in your healthcare provider's office. So if your child is breathing faster than their normal that you have seen, if they have difficulty breathing but they can still talk and it's not severe, or if you have a toddler and there's a new sudden cough with no other symptoms, that needs to be seen at the doctor's office or an urgent care. In the case with the toddler with the new cough, we're talking about they may have swallowed something they shouldn't have. And please note that some urgent cares don't have x-ray machines and other tools to figure out if your child swallowed something they shouldn't have and it's blocking the airway. I would suggest calling the urgent care and asking what kind of tools they have available before going in. That way the urgent care visit isn't wasted time and money, and when you should have gone to the ER anyway because they have the diagnostic tools there. Let's talk about when you could probably see your healthcare professional the next day for a cough. So if there's consistent blood-tinged mucus when they're coughing, or sinus pain with a cough, or fever that lasts a few days with a cough, or an earache with a cough, or if you have a baby, they're having difficulty keeping down breast milk or formula, the concern with that one is dehydration. Or if the cough interferes with sleep, or if the cough is present for more than 3 weeks. Perhaps there's some underlying asthma going on. All those can be seen roughly the next day or the day after. Now, what if your child doesn't fit really any of those things? Most coughs fit a mild case. Most coughs in childhood are caused by viral upper respiratory infections. So if your kid is playful, they're drinking fluids and staying hydrated, they're peeing a good amount because they're drinking enough fluids, they're breathing normally between coughing fits, this can all be managed at home. Yay, congratulations, you made it. You don't have to go to the ER and waste time and money for your child's cough. I just want you to focus on comfort. So for children over 1 year old, you can actually give them a teaspoon of honey to help soothe their throat. Make sure the child is over 1 year old. We do not give honey to children under 1 year of age. You can also use a humidifier, or bringing your child into a steamy bathroom can help loosen mucus. Side note, please remember to clean your humidifiers because mold can grow easily if you don't maintain them, and it can make the cough worse. The goal here at home is simply to manage the symptoms while the body's immune system clears the virus. So, distinguishing between a cold and an emergency comes down to how much effort the child is using to breathe. If they're struggling for air, turning blue, or extremely lethargic, difficulty opening their eyes or staying awake, seek emergency care immediately. If they're breathing comfortably, but the cough is persistent or accompanied by a high fever, a same-day or next-day medical visit is the right choice. For everything else, you can stay at home, just focus on hydration and rest. And if you found this video helpful, please like and subscribe to this channel for no fluff, straight to the point information to avoid an unnecessary and costly ER visits. Take care.